This episode of Health Gig is part of the Evolution series powered by Paragon. We are working with Paragon Performance Evolution to bring you a special series of incredible speakers which have been hand selected from their network to be our guests on Health Gig. Paragon works with companies to bring in authors and thought leaders who can help implement hands on programs which focus on transformation, integration, and greater awareness. They blend the best of modern science, human behavior, and timeless wisdom into all of their programs, which is why we are so supportive of the work they are doing in this world. We are thrilled to be collaborating with Paragon Performance Evolution for this very special series and so happy to bring these conversations to you.
People are yearning for information, having the opportunity to encourage people and to educate people and inspire people.
It's amazing to be able to say we'll carve out time to take care of ourselves.
There's something for everyone. Dr. Amy Killen, board certified in emergency medicine with 10 plus years of direct patient care, has been practicing anti-aging and regenerative medicine for more than 5 years. Amy has a fellowship trained in anti-aging and regenerative medicine through the American Academy of Anti-Aging Medicine and has done extensive additional training in aesthetics, platelet-rich plasma and stem cells, hair restoration, bioidentical hormones, nutrition, fitness, and sexual health. Currently, she is the medical director of BioRestoration Medical, a very busy clinic with a comprehensive integrative approach to health located in Draper, Utah. Today, we're going to talk to Amy about something we don't often talk about, and that's sexual optimization.
Amy, thank you.
Thank you.
So, we're very excited to talk about sexual health. When I was growing up, I barely learned the birds and bees in high school, and my parents did not mention anything to me about sex. I learned all about it in college on my own. But we do know now that it's such an important aspect of our overall well being. And so, how did you get into sexual health?
So it was kind of a roundabout story. I actually was an emergency physician for a number of years. I was an ER doctor for about 10 years. And toward the end of that I had 3 kids of my own. So 3 kids within 2 years because I had twins and then one more. And was just kind of struggling to get back in the ER, had a lot of stress, had a lot of lack of sleep and all the things that, a lot of young mothers have. And I started noticing that a lot of my patients that were coming into the ER were having the same kind of struggles. Like they would come into the ER because they were just overwhelmed and stressed out and having, just couldn't deal with what was going on in their lives. And so I eventually transitioned out of doing emergency medicine and became interested in kind of integrative medicine and preventative medicine and these other ways to take care of ourselves. Once I started doing that, what happened was I had a lot of patients that would come in and after they kind of got past the initial struggle of whatever it was they were dealing with, they would ask me, okay, now can you help me with my sex life?
Mhm.
And I heard this over and over again so many times. So I eventually started becoming interested in, can I help them with their sex life? And so I kind of dove into that field, and that was 8 years ago, and I just haven't looked back.
That's so interesting and yet so important as we were researching you. And again, what I was saying earlier is having so much fun really seeing what you talk about and how you shed light on sex health as a way, as a wellness, almost a wellness practice too, that it's really important for people to understand what having a good sex life means or into your big picture. So it's a holistic way of looking at your health, which is really a new way of looking at it, right, Dora?
Yeah, definitely. I didn't even look at it before. before
Amy, we were
I.
laughing so hard after we got it. Like we were saying, and I remember Dora when the kids were little, remember where they went, they had that sex class. Of course,
Mhm.
I had none. So like Dora had none. But do you remember their teacher told them to come in and they could say any dirty word they wanted to? Do you remember this?
Yes, yes.
And so Dora, after Amy, after we talked to you, Dora was like, I'm gonna say it, Dora. I can't do it.
I have penis, whatever. It's It's challenging when you grow up the way I did to say those words, even though I had 4 brothers. But anyway,
Right.
they won't want me bringing them into this podcast. But, so what are the statistics surrounding sexual health? I mean, what are the things that you find that people what kind of dysfunctions are there and what's going on?
It's people don't talk about it a lot, but we know that about 40% of men over the age of 40 have some degree of erectile dysfunction. So, not all the time, but at least some degree of ED. And that number goes up by about 10% per decade for men. So, 50% at age 50, 60 at 60. And then we also know that about 40% of women have some degree of sexual dysfunction at some point. It may not be all at the same time. And that could be anything from low libido to arousal problems to orgasmic problems to pain or some combination of those things. So, it's a lot of people who have sexual dysfunction. And with men, we know that about 75% of men who have dysfunction, and I would say this is probably even more for women, about 75% of them are untreated currently. So you have a lot of people who are having problems who are not getting treated. And I think that there's a lot of reasons for that, but probably a lot of people just don't know that there are actually treatments out there that are available these days.
That's so interesting. So 70% of men are having um, dysfunction of some sort, and yet they could get treated. Like you're saying, it's just nothing that they have to live with, but that actually they could talk to somebody about. But that brings up the point of shame. Do you think a lot of times people don't talk about it because they're shamed or embarrassed, or how does
Yeah.
that go?
Absolutely. I think shame is a big part of it. Men are told that you have to have this sort of sexual performance. We use the word performance a
Yeah.
lot when we talked about men. Like it's actually like it's a show that they're putting
Right.
on from someone,
Right.
right?
Like so stressful.
Which is really stressful. Like it's a show every time. And I think that's for men, they feel that and they feel like they have to kind of overcome that and be macho and be tough and all of those things. And then for women, I think it's a little bit different. I think women are just kind of told to be quiet, and to kind of just take it, and it's normal and it's fine, and whatever you're experiencing is okay. And it is okay, but if you want something better, that's also okay.
Mm,
Right.
but don't women fake it too? I
Yeah.
mean, they fake it so that they don't hurt the feelings of the man.
Yeah, totally. They fake it for a lot of reasons, but yeah, just so they don't hurt the man's feelings, or just to have it be done with and be over with, because
Right.
it's not
Oh,
very fun.
yeah.
And they're just like, this is. I'd rather be watching Bravo with my with my friends.
Yeah, exactly. Um, so what how do you stay how can we learn to stay sexually healthy? What can we do?
So there's a lot of things. I mean, there are things that you can do just from a prevention standpoint, just understanding that the sexual system is, it's like any organ system in our bodies, and getting blood flow to the sexual organs is really important. And as we get older and we start to have atherosclerosis and plaque building up in our blood vessels, we, start having problems with blood flow. So, anything that you can do that can help your cardiovascular system. So things like, avoiding sugary foods and avoiding sedentary lifestyle and avoiding obesity, and keeping your blood pressure and cholesterol in
Mhm.
check, staying active, exercising, all of these things, avoiding stress, or dealing with stress. All of these things are important just to be healthy, and those go a long way toward reducing sort of full body inflammation, which is one of the risk factors that leads to atherosclerosis and lack of blood flow. So thinking about getting blood flow to the sexual organs is important, because that's one of the major causes of erectile dysfunction in men, and it can also cause problems for women as well. It's just the blood's just not getting there, or if it is, it's not staying there. So that's one of the things that I think that it's an ongoing every day. We should be kind of working
Mhm.
towards that. Smoking is horrible for your sexual system, so please get rid of the cigarettes if you
Stop
can.
smoking.
Stop smoking. Absolutely. And then there's some more specific things. Like, for instance, we know that as you get older, you lose the ability to make something called nitric oxide. And nitric oxide is the main chemical messenger in your body that tells your blood vessels to vasodilate. So, they're small and they get bigger, and that's called vasodilation. And that's how you get blood to different parts of your body. So it's really important to vasodilate. And because nitric oxide is actually made within the blood vessels themselves, as you get older and you develop this atherosclerosis, you can't make as much nitric oxide. And so now you have this problem where you have these more narrow blood vessels because they're already filled with plaque, and you can't open them up and make them bigger because you've lost nitric oxide. So there are some different things you can do to maintain your nitric oxide, but that's another thing that's really important as you get older to think about. So, things like exercise will increase your levels. Getting some sunlight is actually really good for nitric oxide. Like red light therapy, PEMF, some of these sort of gadgety kinds of things that are out there can actually increase nitric oxide. And then eating a diet that's high in nitrates. So things like green leafy vegetables, arugula, things like that, as well as beets are classically high in nitrates. And your body can actually make nitric oxide from some of these foods as long as you're not using antiseptic mouthwash or acid blocking medications.
Yeah, tell us about the mouthwash and Listerine.
So, when you eat nitrate rich foods, your body can convert the nitrate into nitric oxide. And this becomes increasingly important over the age of about 40, because this is a major source of nitric oxide for when we get older than 40. But the first step of that conversion actually happens in your mouth. There are these little good bacteria that live in your mouth, and their job is to convert this nitrate into nitrite. And if you don't have those bacteria because you've killed them with the antiseptic mouthwash that you've been using every day because you thought it was so healthy for you, then you're not able to make nitric oxide from food. So I always tell people you can still brush your teeth, please do.
Right.
And you can you can even do sort of a do-it-yourself mouthwash, but avoid the ones that are going to just wipe out your whole oral microbiome.
That's interesting. So that, yeah, and probably like the more natural ones are fine, I would
Yeah.
think, right?
Yeah.
It's just the ones that have all those antiseptics in it and that kind of thing.
Exactly.
Very interesting. And somebody else said too, when you do have bad breath, oftentimes that might be an indicator of something else, right? A gut health kind of thing. So that's something to listen to as well. And you talk a lot about how looking at sexual health is a way in to somebody's real health. So do you want to
Yeah.
talk a little bit about that? Although you are saying that it's your diet, it's so much.
Yeah, absolutely. It's interesting because a lot of people will come in, men especially, they have erectile dysfunction and they're like, oh my gosh, like we got to fix this. And so they'll come in, with that, and they're expecting that we can just do, one sort of magic wand thing and we can fix it, or give them a pill and they can fix it, which it's possible in some cases. But you have to remember that ED oftentimes is an early warning sign of other things that are going on, particularly cardiovascular disease. A lot of times erectile dysfunction is like the first sign that you have atherosclerosis. And this, it may happen 5 or 10 years before you have a heart attack or a stroke, but it's the sort of early warning sign. And the same thing can happen with women. There's lots of causes of sexual dysfunction. Like, for instance, if you have low libido, it could be any number of things. It could be that your estrogen and your testosterone and your progesterone levels have kind of gotten out of whack a little bit. It could be that your thyroid is too high or too low, or that your stress is a problem and you're not dealing with it, or or that you're inflamed from from the choices that it could be 100 different things that are causing that symptom. And so getting to the root of that actually provides us a way to get healthier without really knowing that we're getting healthier.
Right. Viagra. Can you tell us, does that help? I mean, is that something that people just go on and then it figures it out? Or what do you think about that?
Yeah, I mean, Viagra and the medications like that, they're called the PDE5Is. And the way that they work actually is they prevent the breakdown of nitric oxide. So it's keeping more nitric oxide around longer. So now it kind of all makes sense, right? Like you have this nitric oxide, and if you prevent the body from breaking it down, then it will stay kind of in the sexual organs, in the penis longer. And that allows the blood to flow in and stay there longer. So the problem with nitric oxide is that if you're not making enough of your own nitric oxide, the problem with Viagra is if you don't make enough nitric oxide to begin with, then those medications are not going to work, right? You have to make your own nitric oxide. But I think it's a great tool. A lot of people really like Viagra and it works well. And it's not something that's addictive, and it's not something that, it can be psychologically addictive, but it's not, your body doesn't get used to it and kind of get an addiction to it. And really anything that keeps people, like for men, keeps men having erections is actually really good for the cells within the penis. It's when people stop having erections, especially like nocturnal erections or, any erections, then those cells in the penis are not getting enough oxygen and blood, and they actually will start to die over time. So whatever we can do, whether it's
to keep
using Viagra, using
going.
penis pumps, using, some of
Okay,
these
we
other
wanted
things.
to be the ones to ask about penis pumps.
Oh, you can still ask. Go ahead.
What is it? What is it, and how do you use it?
I should have brought like some toys to show
Yes.
you guys, right?
We wish
Yes.
we had too. Okay, when we were reviewing this, we laughed so hard. Okay, penis pump. But yes, tell us what it is. But it makes sense now. It's just you've got to exercise, right? It's like a muscle. I mean, the penis is a muscle.
Exactly.
Is a penis a muscle?
It's not a muscle exactly, but there are muscles around it.
Okay.
But it's exactly like that. Like when you go to the gym and exercise like your rest of your body, you know,
Yeah.
you get blood flow all different places and you get big muscles and all this. But the
Mhm.
penis actually is interesting because it doesn't get extra blood flow when you're exercising. Like it's kind of like in its own little land, right? The
Oh.
way that it gets extra blood flow is by having an erection. And so either that's you're having
Oh.
sex a lot and you're having a lot of erections, or it's a nocturnal erections, you know, which is something that happens while you're sleeping,
Mm.
or it's something like using a penis pump. So with a penis pump is basically a cylinder that you kind of put over the penis, and then it's a vacuum device that uses negative pressure to pull
Oh.
blood into the penis. And it sounds miserable, but it's actually,
Yeah.
you know, it's not.
Do you use the penis pump before sex, right before you're
Oh,
about to
good
have
question.
sex, or when do you use it? Or do you use it like as a side thing?
You can do there's several ways to do it. If you're having difficulties getting erections, then you can use the pump to get an
Interesting.
erection, and then you
Mhm.
can put like a rubber band, I mean something like a tourniquet or rubber band at the base to keep the blood there in order to be able to have sex.
Oh.
But the way that I have my patients use it most often is sort of as a separate thing, basically, you know, 10 minutes a day of just pumping, kind of get the blood in, let it
Get the
release,
blood
get
out.
the blood in, and that's sort of like exercising your penis.
Mm.
Yeah.
So women have similar devices, evidently. I learned that from you, that you can use to exercise the vagina.
Yeah, there are some really great home devices out there. So for women, one of the main issues as we get older is our pelvic floor starts to
Mm.
become weaker. You know, the
We
pelvic
know
floor.
someone, right, Trisha?
Yeah, it's sort of
We have a
yes,
friend who came
yes.
up to us once, and I mean, I'd never heard of it before, but she said, what did she say?
Oh God, what was it?
It fell. The
Right.
what exactly what you're talking about.
Yeah.
So go ahead.
Is that from having children? Or is
Having
that
children definitely doesn't help.
mhm.
Yeah, you can have, I mean, the pelvic floor is like this bowl of muscles that live in your pelvis. So just think of like this bowl of muscles,
Yeah.
and their ability to stay strong is important for everything from keeping your urine in the bladder, you know, like the people who, when you cough or sneeze and you kind of have a
Mhm.
little bit, urinate a little bit. Sometimes that's a pelvic floor problem. It's also important for being able to have orgasms, being able to have
Right.
pleasure. Like it's this bowl of
Mhm.
muscles that does all these important things for women. And as we get older, or if we've had multiple children, then those muscles become weak. And so some of the tools that we
Yeah.
have are just sort of ways to strengthen the pelvic floor.
Got it.
So certainly you can go to a physical therapist, and I would recommend that if you're having a lot of problems, or you can do Kegels. But there are actually some cool devices out now that kind of help you without having to, you know, to do all those things. For instance, there's an intravaginal TENS unit. Do you know what you know what TENS units are? They're transelectrical
Oh,
neurostimulation. Like
yes,
Yeah.
it
yes,
like causes
Yeah.
your
yes,
muscles to like
yes,
contract.
Yes, we've done that before
Yeah.
for
yes, yeah,
different injuries and things.
So
right.
there are actually devices like the intensity device or the apex device that you go inside the vagina, and it's like a TENS unit for your pelvic floor muscles.
Mm.
And it's these crazy contractions. It's like Kegels on steroids kind of thing.
Oh,
Wow.
But you
wow.
can kind of train those muscles that way. Or there's some red light therapy devices that are like it's red light therapy, which people use for their skin and other things.
Right.
But there's one that goes in the vagina that actually increases the energy production of the mitochondria in the cells, so you can actually have improvement in blood flow and lubrication and sensation and things like that. So there's some
Gotcha.
interesting home devices out there.
Yeah, we have to tell our friend Trisha, who shall remain
Yes,
nameless on the podcast,
yeah,
about the
exactly.
tens thing, because that might be good for her.
You know, one thing that Dora and I talk a lot about just in our world of holistic health and wellness is bio-individuality, right? So every body is different and everything's different. So why is it that some women can be multi-orgasmic and others aren't? And can men be multi-orgasmic and or can they not be?
They can be. There's actually some trainings that men can do. There's some books out there that will like there's like a multi-orgasmic male book. I think that's
Oh,
one of them.
okay.
But basically, with men, it involves not ejaculating when they have an orgasm. So being
Okay.
able to,
Mm.
because those are two different things, like the ejaculation and the orgasm, being
Right.
able to sort of unpair those
Oh,
two
okay.
things and sort of practicing that eventually some men can certainly become multi-orgasmic because they're not ejaculating in between.
Oh,
So
okay.
it's kind of interesting. But and then women,
That
yeah,
is
I mean,
really interesting.
it's, I think with women, it's a lot of it is the same kind of thing. It's a lot of it's training and behavioral therapy kind of stuff, and working on it. Certainly there's a structural anatomy piece of that as
Mhm.
well, but I think that it's possible for most women if they were to kind of work at it.
Right.
Yeah.
That it's impossible and it's there.
Along
Interesting.
those lines, of men having orgasms, more than one, is there too much? Is there too much? Can you have too much sex, or
Question.
is there? I mean, how much sex should people have? Let's be.
That's a question I get a lot.
Yeah.
I don't think there's not a set amount of sex you're supposed to be having. A lot of it's very personal. It very much depends on your relationship and what feels good to you, what feels right
Mm-hmm,
to you.
mm-hmm,
So I would never say you have to have this much sex to be healthy. I will say that most of the studies that have been done that look at sexual health and the benefits of sex in other parts of our health, like benefits of sex on blood pressure or pain or sleep or heart disease or whatever it is, most of those studies have people who are doing sex about 1 to 2 times. People are doing sex. Sorry. They have people who are having sex about 1 to 2 times a week is kind of what that group of people that's considered to be sexually healthy.
And is sex defined as as having an orgasm? Is that what sex is, or
Mm.
is sex the act of intercourse or, with your partner,
Yeah, no,
yeah.
it's you don't have to have an orgasm. And depending on, like in the research, there are some studies that it's partnered sex, like traditional sort of partnered sex,
Mhm.
and then there are some studies that are actually looking at just sort of sex by yourself, like
Right.
masturbation, whether or not you're orgasmic. And so there's lots of different studies depending on what you're looking at.
Mm-hmm.
And so, but no, you don't have to. There's no sort of right way or particular way to have sex, and certainly we know that there's all different variations out there, and you don't have to have an orgasm either. That's just sort of an extra thing that you can do.
So
Right.
interesting. So it's really so what is all the so if you don't have an orgasm, that doesn't happen. Are you still getting the benefits of like good blood flow and all the other things? So it is still happening.
Mm,
You're still getting a lot of the benefits. I mean, there are some benefits just to the orgasm itself, like there,
Yeah.
oxytocin boost and serotonin boost and some of the neurotransmitters in the brain and some things like that. But certainly the bonding experience and the
Right.
the blood flow, all of that,
mm-hmm.
the exercise element of it, like you can have
Right.
all of that
Good
parts of it
point.
without having to have an orgasm.
Mm.
Got it.
You
Yeah,
could.
that
There are
makes sense.
benefits to hugging.
Totally.
Right.
Yeah.
Yeah.
Right.
Yeah. Um. So, um, I've heard you talk about women are wired differently and find pleasure differently, but men are generally wired the same way. Can
Mm.
you explain that?
It's not necessarily always the same, but men are a little bit simpler as far as the sort of the
That's true.
brain to penis connection. They could get the stimuli. There's like it goes down the nervous system, it goes into the penis, and then they have an erection. Women,
Mm.
there's a lot more going on in the head space. I feel like in women there's a lot of triggers that are sort of turning on and off, the desire to have sex and the interest in sex, where that doesn't seem to be quite as common in men seem to be a little bit simpler that way, and I'm not exactly sure why that is, but that's kind of what I see in my patients.
Yeah.
That is so true. I mean, I think it is true. And I think we've even heard you say, and I know we've talked about it too, like it sort of begins at the beginning of the day too for a lot of women, right? Like if their house is a mess, I think you've said, or
Yeah, yeah.
things are not, you're not feeling completely supported in the day, that
Yes,
just, or it just
Yeah.
does play into everything. It's
it
just,
does.
It's
yeah,
so true.
it makes so much sense.
What about pornography? We
Mm,
know someone who who was addicted seriously was addicted to
totally.
pornography, which is a bad thing, I think. But what about, I mean, is pornography okay? A mild dose of it, or I mean, what do you say about pornography and
Mm,
sexual health?
Yeah, I feel like pornography is like anything else, like the dose makes the toxin or the poison.
mm,
Anything can be relatively safe in, in good doses. Water, could be safe in regular doses, but if you were to get too much water, then you could drown yourself and it would be dangerous. I think
Good
that
point.
pornography is the same. Certainly, it is possible to be getting too much pornography, becoming too
Mm,
wrapped up in it. And what happens with pornography is each time you're watching these images, you get this dopamine hit. The dopamine is one of the
Mhm.
neurotransmitters that hits your brain and causes you to have erections and sexual responses. And so it's this feel good hormone, right? Like we love it. It's a feel good neurotransmitter. But so you're watching this pornography and you get dopamine and it feels good. But what happens is you kind of become where you need more and more of that. So you need to
mm,
watch
Mhm.
mm,
more pornography, or you need to watch more graphic images, or you need to watch more
mm,
rough images, or it kind of
mm,
escalates. And then you have someone who really requires like a pretty heavy dose of
mm.
visual stimuli to become aroused. And then you go to the real world, and all of a sudden, your partner, who's a normal person, doesn't look
Yeah.
like this and is not doing those things, and it can
Right.
become hard to get aroused. So I see this a lot in younger men, especially. They're just kind of they're doing so much, spending so much time with pornography and with masturbation in themselves, that they kind of become um, unable to enjoy
Mhm.
Mm.
actual people.
Yeah, that's
Right.
sad. But that's like any addiction, really. You need more and more and more. And then
Mhm. Mhm. So that's so interesting, and it's so true. It's like you said, levels of it is important, right? And at any level it can become a toxin. That's
Right.
a
Yeah.
really good way of looking at it, for sure. You had said for sexual health too, that getting outside in the sunshine, and I think what you were referring to is vitamin D3, or getting vitamin D, right? And getting all the things that kind of, again, keep your body really healthy.
Yep. Yeah. Vitamin D is definitely important for, we know that it's important for hormone production, for like testosterone production
Hmm.
and estrogen and all the different hormones. It also, it feels good. It increases your serotonin, and
mm,
which is also something that's kind of makes you happy. But there's actually benefits just to the light itself of
Yeah.
being out in the sun. So not necessarily the vitamin D, but just the actual light. Again, the light itself can increase your nitric oxide production. So that's one of the ways you could do that, is get out and get a little bit of sunshine. I think that sun, obviously the sun can be dangerous, like like
Right.
kind of like the
Because your skin,
pornography,
yeah, exactly.
but a little bit of sunshine can definitely be helpful, and is definitely a tool that I like for people to use.
To have,
yeah.
yeah.
What about sugar and the effects on sexual health?
Hmm.
I've heard you mention that.
Sugar is, I don't think a little sugar is a problem, but over time, when we're eating either lots of sugar or lots of carbohydrates that get broken down into sugar, that can become inflammatory. And anything that's inflammatory, anything that causes your body to go into this inflammatory state, can put you at risk to develop atherosclerosis and cardiovascular disease, which again is this problem. The other thing with a lot of inflammation is that, like for men, if you have a lot of inflammation over time, it actually can kind of change the cells within the penis. So normally you have these very elastic, smooth muscle cells in the penis, so that they can expand, which makes sense, right?
Hmm.
They can
Right.
expand and fill with blood. But if you have a lot of inflammation over time in your life, from lifestyle or whatever else, then those healthy, smooth muscle cells can actually get replaced by scar tissue or fat cells.
Mm,
And so you
Wow.
lose the ability to have this sort of full erection. And that's actually one of the major causes of being unable to maintain erections, is that the cells in the penis are not healthy. And whether that's from a lot of inflammation, or from low testosterone over time, or from other reasons,
Oh.
that can all happen.
Wow. Well, so if the man has the erection, and like you always see the ads that if you have your erection for more than 4 hours, go to the
yeah.
emergency room. What's that?
Yeah, that's called priapism, and it's basically just, for whatever reason, the nitric oxide essentially is staying put in the penis. It's not getting
Okay.
degraded, and so the blood is staying there, or you have some kind of structural problem that's preventing the blood from backing up. But yeah, when I was an ER doctor, we definitely had patients that would come in, and they'd had an erection for 8 hours, and they
Oh
were
my
like, "I think
God.
that I need some help."
Yeah.
Well,
So what do you
okay.
do? Yeah. But do
you
you
could
do it?
you can start with doing some medications. Like there are certain cold medications actually that can help kind of reverse that
Got it.
like that response. And then worst case scenario, the doctor would actually put a needle into the
Oh,
corpus cavernosum and just
And then
draw out
just
the blood that's causing that.
that's just won't leave.
Yeah.
Wow.
ugh.
Oof.
You're gonna think I'm making this up, but Tricia, we also know someone who that happened to. Okay, I'm just saying it's really true. But I have a question, and I'm not trying to. It's kind of a funny question, but um, men make their penis size like a big thing,
Yeah. Good
right?
point.
And
Right.
and they talk a lot about. I mean, in our hyper sexualized world, we hear about penis size. Okay, I'm not interested in it, but we hear about it. And why is that? And how does that factor into sex? I mean, is it
Oh,
better to
and also the other myth is like thumbs. Are the thumbs an indication of a penis size? So as we're in penis.
hands,
I,
hands and thumbs?
I
Hands.
I have heard the hands thing. I have not heard the thumbs thing.
It's
Yeah.
hands, not thumbs.
I'm sorry.
Show me your thumbs.
See,
um, I think that that's mostly a myth with the
Yeah.
hands. From what I've read, as far as why it's such a big deal, I'm not sure where that came from. I'm not sure when we tied penis size to virility or to like
yeah,
strength or any of those things.
Mhm.
It's not usually an issue. It depends on, obviously it depends on the partner, but with women, what's interesting about women is that only about 25% of women actually are able to orgasm from just regular penetrative sex.
Mm.
So 75% of us actually are able to orgasm from clitoral stimulation, primarily. And so the size of the penis is usually less important because it's not necessarily about how large it is and how far it's going in the vagina. It's about, what are you doing with it? And also, are you using other things to get the clitoral stimulation, which is what actually most of us need?
Mm.
right.
So
S-
interesting.
So, for some of our listeners who are older, what about sex after menopause? How
Yeah.
can you help people with that?
So a few different things for, after menopause, your hormones change a lot. You have a drop in your estrogen, testosterone, progesterone. So one of the things I recommend is talking to your doctor about hormone replacement. So I really am a fan of bioidentical hormone replacement therapy. So that's using hormones that are identical to the ones in your own body. And you can replace estrogen, you can replace testosterone, which is actually important for women as well, and progesterone. And when you do that, you can prevent some of the menopause related changes that happen in the vagina. So if you don't have estrogen for a period of time, then you start seeing changes in the vagina where the tissue becomes really thin and friable and irritated and dry, and sex becomes painful for a lot of women,
Mhm.
and it's not fun. And then of course that feeds back to your brain and is like, let's not do that
Right.
again. And your libido goes down and your arousal goes down. So but getting your hormones kind of back to levels that were a little bit higher can actually make a huge difference, just because it keeps the vaginal health intact, and it
Mm.
also continues to supply your brain with hormones that are saying, hey, let's do sex, this is fun.
Mhm, mhm. And the whole bioidentical hormone issue really has evolved, right? So now all the things that we'd heard before about how it increases risk of heart disease, increases risk of cancer, is that sort of not the case anymore? Or are these a different kind of hormone?
Yeah, so the Women's Health Initiative, which was the big study that came out, I think it's about 10 or so years ago at this point, they were studying non-bioidentical estrogen and progesterone. So the
Hmm.
estrogen was coming from was made from horse urine. The progesterone, which was was actually the problem that was really the problem piece, was the progesterone. The non-bioidentical progestin is what it's called. Though that was the part that caused increased heart attacks and breast cancer and a lot of these things. But because it was all kind of done in one study, everyone was like, okay, we got to stop all of these hormones. So, but really, with bioidentical estrogen and progesterone and testosterone, there's not an increased risk of heart disease or stroke or any of those things with bioidentical estrogen, there's a very small increase in breast cancer risk in certain people. So you want to make sure that you're a low risk person for breast cancer, but
Mm-hmm.
even that is has been challenged quite a bit, and there are so many other benefits like improved bone health and brain health and cardiovascular health and vaginal health and these things to using bioidentical hormones that unless you have a reason not to or you're supposed to it, I think it's worth looking into.
Yeah, at any age, right? You don't, it could be at 50, 55, 60, even 65 to start.
Yeah, you can
You
start at any age. You do have to, if the further you are from when you went
menopause.
into menopause, that you have to be a little more careful with certain types of hormones. Like you wouldn't want to do oral estrogens, for instance, just because there is a slight increased risk of blood clots and some things like that if you if you're to wait a long time. But there are still so many other options. There's transdermal, which goes through the skin. There's
Mhm.
sublingual, which goes under the tongue. There's pellets, which we do little procedures and put them in. So there's a lot of different ways that we can use these hormones. So depending on where you are, your symptoms, your age, your
Mhm.
genetics, all kinds of things.
So, in order to take the bioidentical hormones, is there an age limit or can you do it at any age?
You can really start at any age.
Start.
Most people are going to be within 10 years or so of menopause, and the further you get out from when you went into menopause, the riskier it is to start certain types of hormones, like hormones, can increase your risk of heart disease and sorry, can increase your risk of heart disease and blood clots. So you want to sort of look at your different options. We can do hormones, like we can do transdermal hormones through the skin. We can do sublingual under the tongue. We can do pellets where we do little procedures and put them in, or you can do oral hormones. So there's different hormones that can be useful depending on your age, how far you are from menopause, your genetics, things like that.
And again, that's going to help, like you said, not just your vaginal health or sexual health, it's helping all other kinds of things too.
Yeah, there's definitely benefits with bone health, which is a big one for women. We know
Mhm.
estrogen is very helpful for preventing some of the bone loss that we have with age and the osteoporosis. And there's studies that show that it can be helpful for everything from brain health to cardiovascular health to keeping your muscles strong and avoiding sarcopenia, which is when you lose muscle strength over time. Like testosterone is
Mhm.
important for that. So there are a lot of things like that that you want to look at, like not just how are you feeling right now and can we make you feel better, but also like what's going to happen in the next 10 years, 20 years, 30 years, and can we prevent some of the age related declines in health and frailty that happen with age.
Right. And
Yeah,
especially since we're living longer too.
Yeah.
Sorry, Dora.
I thought it, no, I was just going to say, I thought it was so interesting when I heard you say that for men, the testosterone levels go down with age, but it's also gone down through history.
Yeah. Yeah, our as a population, our men's testosterone levels now are quite a bit lower than they were even 50 years ago. And there's a number of reasons for that. I think that one reason is our men are less active. They're sitting around more, as are our women, but they're less active. They're more overweight, which is going to reduce your testosterone. There's more diabetes, which is going to reduce your testosterone. There's more sort of environmental toxins, which can wreak havoc on
Mm,
the hormone pathways. There's all these different reasons. Our stress is a lot higher, or
yeah.
chronically at least, which is also going to reduce testosterone. So there's a lot of things that we are doing now as a population that are unhealthier, and it's being reflected in the fact that our men now have lower testosterone levels, lower sperm counts, lower ability to be fertile, which I think is going to eventually come back to bite us.
Yeah, that's
Yeah.
really fascinating. I guess it's just, again, looking again a different way at health and wellness, but that's everything you just mentioned is all inflammation, right?
Yeah, there's a
Chronic
lot of inflammation.
inflammation.
Yeah,
Yeah.
yeah.
And I guess that's also, if people are stressed, that also plays into obviously not being able to enjoy sex the way you would want to because you're just unable to do sex because you're so stressed out. I mean, your body
Yeah.
physically can't, right?
Yeah, it's interesting because sex, you really want to be in a parasympathetic state, which is that rest and relax state,
Hmm.
right? Versus a sympathetic state, which is the fight or flight state. And
Right.
it makes sense if you think back to like our ancestors. You wouldn't have a hunter who's out, hunting game and running from tigers, and they're out there surviving and doing all these things. You wouldn't have that same guy also thinking about sex and being ready to go have sex, with his
Right.
partner. It's kind of either or. Like he's doing this thing, he's fight or flight, he's excited, he's stressed, whatever. But then when he goes back to camp, and he can relax and he can weave some baskets, that's when he's ready to have sex. And so, but a lot of us are stuck in this place where we are chronically stressed, chronically have high cortisol and adrenaline and all of these hormones. And so we have a hard time, dropping into that relaxed space.
Right. So interesting. Is there a difference in your mind? And maybe this is, I don't know if this is medical, but a difference in your mind with a love partner and just sex with just anybody? Do you see any difference in that?
It's not my field of
Yeah.
expertise, really. I have patients who have long-term partners, and I have patients who have multiple short-term partners.
Right, right,
And
right, right.
my goal for them is to be able to be healthy enough to have sex in the way that they want to, whether it's with themselves or with the partner or with 10 partners.
Right, right, right. That right. You're just into the function of the body, right? The
Exactly.
Yeah,
health of the
right.
body.
You can't get
And
into
how
the
you want to
head.
choose to use it is
Yep.
yours.
Yep.
Got it.
So we why should we be having more sex?
So sex is really powerful. It's really beneficial. We know from an emotional standpoint, people who have an active, healthy sex life, they tend to have less depression, less anxiety, better self confidence. General an increase in happiness. There are some studies that show that an active, healthy sex life as you get older can reduce your risk of cognitive decline. So it can actually improve your memory and it changes some things in your hippocampus in your brain. So that's important. Having an active sex life can reduce your blood pressure. It can help you sleep better. It can reduce your pain. There's actually some interesting studies with migraine patients, and when they are more sexually active, their migraine pain is less than when they're not having sex. So there's this interesting sort of sex pain thing. Sex can be helpful for boosting the immune system. There was actually a study in college kids that showed that if they had sex 1 to 2 times a week, they had higher salivary IgA levels, which essentially gave them some protection against colds and viruses
Wow.
compared to their colleagues who were not having sex that often. And then there's the social benefit of sex, which I think is really important. Is it brings patients closer to their partner or partners. And this is what I see in my practice. I have patients who come in and they have sexual dysfunction. They don't complain to me that they have high blood pressure or their immune system isn't working as well. They complain to me that they feel disconnected from their partner. And this is what bothers them. And as someone who's looking at this, I see that we're sort of in this world where disconnection is more and more common, right?
Yeah.
And loneliness and disconnection kill as many people, they say, as obesity and alcohol abuse at this point.
Mm-hmm.
So I think that the ability to connect and to sort of exercise our humanness in this world where that's becoming more rare is, I think, really important.
Yeah, really important. That's such a good point.
Yeah.
What about alcohol? What about alcohol and marijuana and all those kinds of drugs or toxins, or however you look at them? What role do they play?
So alcohol, if you just have a little bit of it, can lower your inhibitions. So can make you feel more sexual or be more ready to to approach someone or to do things maybe you
Right.
wouldn't do. But ultimately, if you get too much of it, it's a depressant. So it's going to make you sleepy and tired, and then all of a sudden you pass out. So I think it's kind of depends on how much you get. Certainly, chronically, if you're abusing alcohol, then that's going to cause problems with your sexual systems and organs. There's a lot of inflammation. There's liver disease. There's all kinds of things that are going to play into that.
Mhm.
But acutely, it's really kind of about how much you're taking and whether that's going to be helpful or harmful.
Right,
And
right.
the same is probably true for cannabis and marijuana
Yeah.
products. It depends on the strain and such, but they can sometimes be helpful. But again, if you get too much, it's just going to make you tired and you're going to go to sleep.
Right. And kind of defeat the purpose of what you were probably using it
Right.
for.
I have a question. I mean, is there a certain age limit where you really need to stop having sex? Like, for example, I remember when Vice President Nelson Rockefeller died on having sex with his mistress. I mean, is that a crazy question?
Not a crazy question. When I was back in the ER, my ER days, there would always be patients that would come in at like 5 a.m., 5 and 6 a.m., and it would be men who are having chest pain, who are having heart attacks. And one of the questions I always ask them is, "What were you doing before this came on?" And a lot of times they were having sex. So yeah, I mean, yes, you want to have enough cardiovascular fitness to be able to have sex, but assuming that you are cardiovascularly fit, then I don't think there's any age that you should stop.
Right. That's good. That's good. What about like all the new things? Because you're anti-aging longevity expert as well. What about all those new things like PRP, stem cells, shockwave therapy, that kind of stuff? Can you talk to us about that?
Yeah, absolutely. So we do a lot of that in my practice. So I'll start with shockwave therapy. Shockwave therapy is also called low intensity extracorporeal shockwave therapy. That's the long version. In the U.S., there's a company called Gainswave that has kind of brought this to the public. But basically, the idea behind it, we use it for men primarily, although we can use it for women. But it's to treat men with erectile dysfunction or just to kind of increase, erectile function. And it's basically a machine that uses high intensity sound waves that
Mm.
delivered through this handheld device into the penis. And the sound waves cause a little bit of trauma, mild. And what that does is it tells your body, hey, we have a little trauma, we got to repair this. And so all of a sudden you have this regeneration of tissue. You have
Huh.
increased blood vessel formation, you have increased nitric oxide, which we've talked about and we love it.
Right.
We have stem cells coming in, repairing the tissue, repairing those smooth muscle cells that were maybe not working as well, or even nerves have been regenerated with some of these technologies. But essentially, you do a series of treatments, usually 6 or 12 over the course of a few months, and it can be game changing for men
Mm.
with ED. It's something that's non-invasive. It's easy. It takes 30 minutes at a time, and there are actually some home machines that have just come out that I don't have enough information to recommend them, but I can say that I have
Mhm.
some patients at least that have reported back some positive findings with that.
Oh, that's great. Huh,
Yeah.
shockwave therapy treatment. Awesome.
Shockwave therapy. And then the other things that I do a lot of like regenerative injections. So platelet rich plasma, which you mentioned, which is PRP.
PRP.
Platelet rich plasma just comes from your blood. So I take the patient's blood, I spin it, and I isolate the platelets, and I get that platelet layer, and then I essentially inject that back in. So for women, I'm injecting the clitoris and the anterior vaginal wall, kind of where the G spot is. And for men, I'm injecting into the penis itself. And basically, what PRP does is it's same kinds of things. It communicates with the body, tells your body we've kind of had an injury, increases blood
Mhm.
flow, repairs nerves, increases the health of the cells. And we can also use sort of stronger things now. We can use stem cells from the patient, like the patient's bone marrow or the patient's fat. We can get some stem cells from those tissues, or we can use
Wow.
something like exosomes, which are kind of like the action arm of the stem cell. Essentially, they have little growth factors and messenger RNA and such, but essentially we can use exosomes almost like we would stem cells to try to bring about the same types of regenerative changes for both men and women.
And are these pretty effective? Are these treatments finding
Yeah, I
um
mean, unfortunately, there's certainly research out there looking at stem cells and PRP. There's less exosome research because they're pretty new, but there are studies that have shown that stem cells can be helpful for men who have ED from any number of causes like diabetes or high blood pressure or prostate disease in restoring either not always full function but partial function. For instance,
mhm.
I had a gentleman a couple of years ago that I saw in my practice who had had a prostate cancer and he had surgery for it. And afterwards, he had severe ED. He wasn't able to have an erection despite trying Viagra and injectables and all of these things. And he had
Oh,
gone to his urologist, who basically had said, we can put a prosthetic penis
oh,
inside, but there's nothing else we can do. And this guy was, he was 50, he was young,
yeah,
he was
yeah.
healthy. So he came to see me and I told him I wasn't sure that it would help, but let's give it a shot. And so we did some stem cell and PRP injections in the penis, and then the shockwave therapy. I think he did like 12 sessions and made sure his testosterone was good.
Wow.
And about 4 months later, I talked to him and he said that he and his wife had just had sex for the first time in 4 years.
Oh. Oh, that's awesome.
Yeah,
Yeah.
and it's not all it doesn't always have that sort of good
Happy
ending to the
ending.
story, but it sometimes does, and that's, I think, really powerful.
Yeah, yeah. It's incredible where science is going and what's happening now. So it's amazing to hear you talk about that. Boy, you are so fun to talk to, Dora.
Yes.
Do we have any other questions, or is there something that we didn't ask that most people want to know about Amy?
The other thing we haven't talked about is, well, there's lots of things probably, but one of the other things we can do for women in the office is there's a number of vaginal lasers and vaginal radiofrequency devices that we can use in the office that can help with restoring tone and tightness and lubrication and sensation and help with stress urinary incontinence, which is the peeing when you sneeze a little bit.
Right.
So these are some in-office treatments that we can do, and usually it's 1 to 3 treatments. They're painless, they're non-invasive, and they use a combination of either light or heat or the combination of those things to increase the vaginal collagen production and elastin and increase blood flow. So it's something that oftentimes I'll pair like a laser or radio frequency treatment with some injections, and then I'll send the woman home with some kind of homework, I call it, like one of these devices for home, and then have them see someone else to make sure their hormones are in balance or whatever. So it's kind of it's a combination of things, but there are a lot of tools in the toolkit now.
Yeah, it's just so interesting and fascinating, and just really appreciate that you're out there talking about this,
it. Yeah,
because
and
it's
providing this
really
information.
important information that people so often just shy away from discussing. So thank you for
Yes,
this.
Well,
thank
thank
you. I know
you.
I've learned a lot, that's
I
for
do
sure.
too. I do too.
Well, I'm just excited that you guys said the word penis on it on
Oh,
the air.
I
Well,
know.
it wasn't easy.
Well, we were
Thank you.
laughing because we're like, oh God, our sons are going to be listening to this. Maybe. But then-
Well, Amy, thank you so
yes,
much for
thank
joining
you.
us today.
Thank you, guys.
Thank you for joining us on Health Gig. We loved having you with us. We hope you'll tune in again next week. In the meantime, be sure to like and subscribe to this podcast and follow us on healthgigpod.com. I'm Trisha.
And I'm Doro.
Be well. To learn more on how to live a co-mindfulness life, visit comindfulnessproject.com.